many opening in the right atrium. These opening including opening of superior vena cava and inferior vena cava, and opening for coronary sinus and atrioventricular orifice. طيب. And I think no, it's closed. Normally it should be closed. This one, this is a fossa ovale, but it is not opening. طيب. And actually, again, you know this chamber. What do you call this chamber? Right ventricle. And this one? Left ventricle. And this one? Right atrium. Right atrium. And this is a left atrium, in which there is an opening in left atrium for what you call pulmonary veins. طيب. Are you aware with coronary arteries? طيب. What do you call this artery?
Right coronary artery.
This is a right coronary arteries, in which it gives many branches. One of these branch anterior ventricular or right marginal artery, and it's continue posteriorly as posterior interventricular, صح? طيب. The important one actually for what we call, now this is the right coronary, should be there a left coronary, and the left coronary divided into two branches. What do you call this one? Anterior interventricular artery and circumflex. And the anterior interventricular artery supply what? The supply right ventricle and left ventricle. The anterior interventricular artery supply right ventricle and left ventricle. Now, do you know what we call this vein?
Coronary
It's
sinus.
called coronary sinus, which is located posteriorly. And you know the veins of the heart. We have on the right small cardiac vein, صح? And on the left there is a great cardiac vein. And posteriorly we have middle cardiac vein. And all of these veins, either small cardiac or great cardiac or middle cardiac, those consider attributes for coronary sinus. It's okay? طيب. You know this pulmonary trunk, صح? And this one? This which part of aorta? Ascending aorta. But you know,
دكتور لازم نحدد السندنج ولا
yes. You know the paramedical can they assign which is this part. What about the medicine? Now you know the arch of aorta. We should have a large جيب لي large heart. Any question for the heart? Any question for the heart? It's clear? Huh? Where is the ligament? Arteriosa?
ما تبان هنا.
دكتور ممكن نستعيد البان.
For the veins of the heart we have on the right small cardiac vein, and on the left not a small cardiac, it is a great cardiac, and posteriorly there is middle cardiac, and all of these veins, small, great and middle, consider attributes for coronary sinus. Now for the heart. شكرا يا والله ما انسى اسمك. رحيق يس. انا تذكرت اسمك على الجوال. طيب, you know this ascending aorta, and this is what do you call this part?
Arch of aorta.
Arch of aorta, and we have how many branch? Three branches. This is the first one on the right for what we called brachiocephalic artery or trunk, the same. Brachiocephalic artery that give two branch. Right subclavian and right common carotid. Whatever. If we talk about the branch of arch of aorta, forget those branch. Just we are considered just with the main branch, which is brachiocephalic trunk and left common carotid, left subclavian, brachiocephalic artery. That's supply right side of the arm and head. Now brachiocephalic artery, left common carotid, left subclavian. Now the right common carotid and right subclavian, those arise from brachiocephalic, but the branch of arch of aorta are brachiocephalic, left common carotid, left subclavian. That's it. Right. But can you mention the nerves that's related to the arch of aorta? Huh?
Vegas.
Which one of the vagus? Left vagus, okay, and
قدام. لا رايت.
left, no, left vagus, and you know left vagus give a branch inferior to the arch of aorta, صح? Then it recurrent back for what you call left recurrent laryngeal nerve. Those are two nerves that related to
The arch of
arch of
aorta.
aorta. Left vagus and
Recurrent.
left recurrent laryngeal nerve. طيب. طيب. Now you know that anterior to this branch of arch of aorta we have large veins, great veins. One on the left and one on the right. This one is called which one? Left brachiocephalic vein. And this one? Right brachiocephalic. طيب. Now that means this is a left brachiocephalic, right? This is left brachiocephalic and this is right brachiocephalic, in which either left or right, those formed by united of left or right subclavian and internal jugular. صح? Internal jugular and subclavian. And if we talk about a left brachiocephalic vein, this is what we call left. What do you call this vein? Left brachiocephalic. It's formed by united of left internal jugular and left subclavian. And it cross to the midline, cross the midline to the right side, to united with the right brachiocephalic. But can you guess what is the anterior relation for these, especially left brachiocephalic vein? What's the relation for this vein? Do you think sternum or manipulum of sternum, right? Or the sternum as a general? And do you remember thymus gland? Yes, the thymus. That means related anteriorly to the left brachiocephalic vein, for example, sternum and thymus gland, صح? You know, between the thorax and abdomen, there is a muscle, apparently, for what we call the diaphragm. Can you guess what's the nerve motor supply? Or yes, this is a phrenic nerve. This is a motor supply for the diaphragm. But what about the sensory also?
Lower.
You know, there is a central part for diaphragm and peripheral part. You know that the motor nerve supply for phrenic as a whole are the phrenic nerves. But what about the sensory? The sensory for the upper central part near the pericardium and the parietal peritoneum inferiorly in the central part, the sensation also carried by phrenic. But the sensation from lateral two dumps or peripheral two parts of the diaphragm carried by what?
Lower 6 intercostal.
Lower 6 intercostal nerve. Right. And you know how many openings we have in diaphragm? We have 3 openings. This opening is called caval opening, right? Caval opening. Through which this caval opening passes what? Inferior vena cava and left phrenic nerve, صح? Left phrenic. Huh? How's the right? You know inferior vena cava on the right side. So that's left, sorry. Yes. تعبان اليوم في الموزع. Inferior vena cava and right phrenic nerve. Inferior vena cava and right phrenic nerve. I'm so tired والله, I'm sorry. طيب. بقول لها لا ما هو على الرايت كمان. طيب. Another opening in the diaphragm for what we call esophageal opening, through which what's the structure that passes from the esophageal opening? Esophagus.
Right
And the friends of esophagus, right and left vagus nerves. And the esophageal branch of left gastric artery. Esophageal branch of left gastric artery. And lymphatics. Clear? Again, esophagus, right and left vagus, esophageal branch of left gastric artery, and lymphatics. This is about esophageal branch. Now, what about the third branch? For what we call aortic opening. This is an aortic opening. What's the structure that passes from aortic opening? Aorta, thoracic duct, and azygos vein. Aorta, thoracic duct, and azygos vein. Clear?
قلت له الليفت فرينك ما بينزل لتحت؟
شو هو? No, it inserted on the left side of the diaphragm. طيب. This is about diaphragm. Now, if we begin with the abdomen, you know the large accessory organs for what you call the liver. You know the liver is composed from how many lobes? 4 lobes. The right lobe and left lobe, and inferiorly there is quadrate and posteriorly caudate. You know what's the meaning of caudate? In caudal. You know rostral and caudal? Caudal, that's mean tail. That means this is anterior and this is posterior surface. That means this part is called caudate lobe, in which we know that the right and left lobes, right lobe and left lobe of liver, divided by falciform ligament. And on the inferior free border of falciform ligament, there is a ligament for what we call ligamentum teres. طيب. طيب. Posteriorly again, what we call this lobe? Caudate lobe. Caudate lobe. In which, on the right side, there is a groove for inferior vena cava or inferior vena cava. The relation for caudate lobe on the right, the groove for inferior vena cava. But on the left, a groove for what? Ligamentum venosum. You know, this is a ligamentum teres. Forget. This is along with the falciform ligament, صح? But posteriorly, there is a ligament for what you call, not ligamentum teres, it is ligamentum venosum. Again, for the posterior surface of liver, caudate lobe related anteriorly to the groove for inferior vena cava and inferior vena cava, and to the left for group of ligamentum venosum. And in the visceral surface or inferior surface, we can find what you call this area.
Porta hepatic.
This is called porta hepatis. Can you mention the 2 or 3 structures from the porta hepatis?
hepatic artery.
طيب.
Portal vein.
Right and left hepatic duct. We said that. Right and left hepatic duct. Right and left hepatic artery. And portal vein. In addition to lymphatics that pass along the arteries. طيب, you know gallbladder, which it's composed from fundus, body, and neck. Fundus, body, and neck. In which, you know this one? Cystic duct. You know that the cystic duct united with common hepatic duct. Because we know that this is the right and left hepatic duct united to form common hepatic duct. The common hepatic duct united with cystic duct to form common bile duct. So that means this is a porta hepatis, including right and left hepatic duct, right and left hepatic artery, and portal vein. Please جوالاتكم على الصامت. حط جوالاتكم على الصامت. Any question for liver?
Hepatic vein من فوق.
This is a hepatic vein. This is left hepatic vein that drain the blood from the liver, from either right or left to the inferior vena cava. You know what we call this area?
Pear area. The liver.
Pear area. That's not covered by peritoneum, you see? Not covered by peritoneum. It is in the direct contact with the diaphragm, in which the abscess accumulated there. Any question for liver? You notice organ for what you call stomach, in which mainly it's composed from fundus, 4 parts: fundus, body, pyloric antrum, and pylorus, in which there is 2 curvature: lesser curvature and greater curvature. Like, you see, if there is a landmark like this one, you will write what, for example? Greater curvature of stomach. But you know the blood vessels for the stomach, in which in the lesser curvature there is a left gastric and right gastric artery. But for the greater curvature, what the blood vessels? Right and left gastroepiploic arteries. right and left gastroepiploic arteries that passes through the layers of a greater omentum. You know the greater omentum? Yani that means this is a greater, this is a lesser curvature, and this is a greater curvature. This called left and right epiploic, gastroepiploic artery, صح? Right and left gastroepiploic artery. You know this rogi, huh? This is a mucus floating interior membrane called rogi. And you know this cardiac orifice, which is a physiological sphincter, and cardiac orifice or cardiac sphincter and pyloric sphincter. Any question for stomach?
دكتور الأصفر اللي تحت الأسود شو هو؟
greater omentum.
Greater omentum. One layer of greater omentum. Now, as we begin with the small intestine, you know the small intestine formed by duodenum and ileum. And you know the small intestine stabilized to the posterior abdominal wall by mesentery. That's mean what we call the structure? Mesentery of? Oh, it should be ماشي ندور على mesentery. See, this is a mesentery of small intestine. Mesentery of small intestine. Can you guess the content of this mesentery? If we talk about this small intestine, we have to find superior mesenteric artery, inferior mesenteric superior mesenteric vessels, lymphatics, nerves, and fat. You know mesentery of small intestine, in which it is a double layer of peritoneum. If we open it, you see cadavers. You see between the two layers of cadavers, of mesentery of cadavers, we can find, maybe your colleague, we can find superior mesenteric vessels, fat, and lymphatics. What else? And autonomic nerves, right? Yes. يعني the most important structures: superior mesenteric vessels, fat, and lymphatics, right? طيب. And you know, as a continuation for small intestine, you know this junction for what we call ileocecal junction, صح? This is ileocecal junction, and this is a cecum, in which this part is called appendix. طيب. And this is ascending colon. And this one transverse colon, descending sigmoid, and so on. طيب. Do you know the blood supply for the large or small intestine? For example, for almost all of small intestine, superior mesenteric, including also appendix, cecum, ascending colon, and the proximal 2/3 of transverse colon. Those supplied by what? Superior mesenteric. But the distal 1/3 of transverse colon and the remaining part of large intestine is supplied by inferior mesenteric. But exactly in details, the proximal 2/3 of transverse colon supplied by which artery exactly?
Right colon. Right colon.
Middle colic. By middle colic, which is a branch from superior mesenteric. But the distal 1/3 supplied by left colic. Left colic artery, which is a branch from inferior mesenteric.
يجرب يبقى
I think you are aware with these blood vessels, including celiac trunk, superior mesenteric artery, and inferior mesenteric, and those are gonadal arteries, صح? Gonadal artery, either ovarian or testicular. Either ovarian or testicular artery, it is male or female. Where's the kidneys, please? Models of kidneys. Now, how can we differentiate for the kidneys? How can we differentiate between the right kidney and left kidney? This is right or left? This one.
right.
This is right. How do you know? Suppose there is another plastic model other than this one. How can you differentiate it?
في وحدة
You know, always the renal vein anteriorly and the ureter posteriorly, or renal pelvis or ureter posteriorly. You see, always the renal pelvis or ureter located posteriorly. That means this is anteriorly and this is posteriorly. That means this is the right kidney and this one left kidney. In which, do you know the relation for these kidneys? For example, let us at the first to talk about right kidney. Do you know the relation anteriorly for the right kidney? No. Actually, the anterior relation for the right kidney, including right suprarenal gland and liver and second part of duodenum and right colic flexure. Again, the anterior relation for kidney, right suprarenal gland, liver, second part of duodenum and right colic flexure. صح؟ طيب. Now, what about the anterior relation of left kidney? What you said, it's okay. Left suprarenal gland, stomach, pancreas, spleen, left colic flexure. What else? Coils of jejunum. Thank you. You get it? Yes. Now what about the posterior relation for these kidneys? You know that the right kidney lower than the left kidney. That means the posterior relation for the right including ribs number 12. But for the left kidney, 11 and 12. This is about the bone. What about the muscle? There is quadratus lumborum for both. Quadratus lumborum. Psoas major. And what else? Diaphragm. Bravo عليك. There's 3 muscles. Actually, those 3 muscles: diaphragm, quadratus lumborum, and psoas major. What about the nerves? L1, iliohypogastric and ilioinguinal. Both the same. And right and left costodiaphragmatic creases.
ترى ليش بتشوف؟
لا ما اقدرش. تعالي هنا. تصوير انا قلت في تصوير واحد. في تصوير واحد. ما اقدرش ازعج زميلي. And you know those are two ureters, right? And this is a vas deferens, and those are seminal vesicle located in the posterior surface of the urinary bladder. This is a vas deferens. طيب. لسه about kidney. Any question for kidney? طيب. What we call this muscle? These three layers of muscles. طيب. External oblique, internal oblique, and transversus abdominis muscle. Transversus abdominis muscle. You see the direction of fibers? Right. What's the nerve that supply these muscles? Those actually from spinal nerves from T7 to T12 plus L1. From T7 to T12 plus L1. Or we can say that the lower 5 intercostal nerve plus subcostal nerve plus L1. That's it, صح؟ طيب. You know the structure is the ureter, huh? Those are ureter. طيب. قلت لكم حطوه على الصامت يا اولاد.
السبلين
ها؟
السبلين
You
والبانكرياس.
know this is anterior border, and there is a gastric impression and renal impression, and there is a hilum including splenic artery and vein, which is related posteriorly to ribs number 9, 10, 11. مظبوط يا عبير؟
والبانكرياس ما
بنكرياس
مش فاضي له ولا؟ طيب. Now, this is a male genitalia, sagittal cross-section for genitalia. You know, for the penis, it's composed from 3 columns. It's composed from 3 erectile columns or tissue. The upper 2 columns is called corpus cavernosum. Corpus cavernosum. Those actually one on the right and one on the left. Corpus cavernosum. But the inferior column is called corpus, not cavernosum, corpus spongiosum. In which inside the corpus spongiosum there is a penile urethra. You see the penile urethra? Or it's called spongy urethra. The penile urethra or spongy urethra, because this urethra located in corpus spongiosum. تفهمين على corpus spongiosum cavernosum? If you take a cross section for the penis راح تلاقيه بيتكون من 3 columns. 1 2 ومن تحت ثالث. يعني هيك. هذا upper two columns and inferiorly third column. Those are corpus cavernosum. And this one, corpus spongiosum, including inside penile urethra or spongy urethra. طيب. You know, I think this is for the penis, and this is a glans penis. The glans penis, an extension for the corpus spongiosum, for what you call the glans penis, the head of the penis. And this is the root. And we know this is a testis, epididymis, and this is again a testis. In which, what we call this one, this structure, spermatic cord, including many structures like testicular artery, pampiniform plexus, vas deferens, and artery for this vas deferens, lymphatics, autonomic nerves, genital branch of genitofemoral nerve. Do you remember? Genital branch of genitofemoral nerve. You know this is a urinary bladder, right? And this is what do you call this organ? Or this is structure, not organ. This is a prostate gland. What's the duct inside this gland? And prostatic urethra. There is a prostatic urethra and ejaculatory duct. Prostatic urethra and ejaculatory duct. You know what's the structure? Haram alik. And this one? You know the vas deferens that passes from spermatic cord, inguinal canal. بعدين بلتف طريقته اللي بنعرفها. And this is a ureter, huh? Any question for me? Again, for the female, you know, this is ovarian arteries and vein. شو وين راح جسمي هنا؟ روح تعبان. طيب وهذا this one which is a ureter, and this is a uterus including fundus, body and cervix, and this is a vagina, labia majora, labia minora, and this is a clitoris, the stimulatory organ in female, supplied by sensory nerves, clitoris, and this is a urinary bladder. طيب. In lateral view for internal genital organs for female, you know, just take a lateral look. We can see that this is a uterus. The uterus attached laterally by ligament for what you call this ligament? مش بالابدومينال وول تفضحينا. باللاترال بلفيك وول. باللاترال بلفيك وول برود ليجامنت. حرام عليكم. برود ليجامنت صح؟ برود ليجامنت in which there is structures or before structures, and this is an for what you call ovary, and this one
ovarian tube.
مش مبين الأوفريان ligament. Ovarian ligament, it's not appear there. Just this is an ovary, and this is a fallopian tube that passes on the upper free border of broad ligament. This is a fallopian tube, in which this is an infundibulum, ampulla, and isthmus, right? And intramural part. Those are part of fallopian tube, in which in the infundibulum there is finger-like projections. We know that this is infundibulum, but on the distal part there is a fimbria, finger-like projections that trap the ovum. طيب, in the broad ligament there is many structures pass through, in which including fallopian tube, ovarian ligament should be there, part of round ligament, and actually uterine artery and ovarian arteries or vessels. Uterine vessels and ovarian vessels. Those passes through the layers of broad ligaments. Be aware for these vessels, especially for the theory. You know what we call this ligament? Round ligament. It is passes to the labia majora in the inguinal canal instead of spermatic cord. صح؟ Instead of spermatic cord. مظبوط؟ Round ligament. طيب, this is a section طيب, this is a uterus in which this is a round ligament, صح? And this one fallopian tube, صح? Fallopian tube, and the last one posteriorly, which is this one that attached the ovary to the uterus, is called ovarian ligament. Simple, صح? And what do you call this ligament? Broad ligament. This is a broad ligament in which the ovary attached to the posterior surface of broad ligament. صح? You have to see the muscles on the cadavers. بهدوء أنا أروح على الكاديفرز اللي هنا بدون كراسي مثلا.
هناك شوية.
Actually, this is a rectus sheath in which the anterior layer of rectus sheath, including external aponeurosis, external oblique aponeurosis, and there is another layer, anterior layer of internal oblique aponeurosis. If we remove it, we can find what do you call this muscle? Rectus abdominis muscle. Rectus abdominis muscle. It is originated from where? Symphysis pubis and pubic crest. There is another textbook they said also from pubic tubercle, but leave it. Just symphysis pubis and the pubic crest, and inserted in costal cartilage number 5, 6, 7. It's supplied by which nerve?
Intercostal.
From the same from like these muscles, from T7 to T12, but without L1. Without L1. From T7 to T12. Or you can set the lower 5 intercostal nerve plus subcostal nerve. No, spinal nerve number 12. And you know this is a spermatic cord, صح? You know the spermatic cord, صح? And the content. That's okay. And this is an epididymis, you know? صح؟ مظبوط؟ This is an epididymis and this is a testis. And this is a vas deferens. Any question? خلاص؟ يعطيك العافية. الله يعافيك.